I'd like to return to something Roberto said about needing to go through providers before you introduce direct-to-consumer. So do you all, first of all, does that apply to almost all kinds of technologies? And if so, should we just view that as in a way, a tax on innovation in the healthcare system that will just make it take longer to introduce innovations? Marty?
I think the best innovations. I don't think innovation has to be delivered through the provider community. We're seeing at HLM, we're seeing some very interesting companies that are working with Medicare Advantage plans and Medicaid plans and dual eligible plans to really take innovative service delivery models to the sickest of the sick, taking them into the patient's home. But I do, and that's obviously sponsored on the plan side, but I do think the best and the most successful innovations and behavior change tools will be provider-centric.
So I would say that I was not a proponent of Obamacare. I thought it was a bad idea, badly constructed, but there are often unexpected consequences, and the unexpected consequence is that actually it's creating a lot of opportunity for new kinds of innovative businesses. Why? Because now suddenly everybody has to do something as opposed to do nothing. And it seemed to me that the insurance payers didn't move unless they had to move. And now all of a sudden there are a lot of people starting to say, hey, I could change the value chain. And there are a lot of pieces. The value chain is complex. But I think there's going to be a lot of innovation because Obamacare needs to be, people have to adapt to it, and it needs to adapt, and it's going to create opportunities. So even though I was opposed to it, I think there's still a lot of opportunities that are resulting, because of it.
Would like to turn to see if there are questions from the audience. There's one over here.
Hi, I'm Karen Daly from the American Nurses Association. So I just want to say that I agree with your one comment that was made around the fact that technology is not the total answer. The reality is the human aspect of healthcare, the relationship, the trust building is really key. And I think we have certainly, from nursing standpoint, had many demonstration projects that have demonstrated consistent success around things like care coordination, transitional care, and the need to partner with patients, particularly those that are high risk and comorbid. So I'd just be interested in your comments.
Well, I think you're absolutely right. And I think especially with these disease states where you have high comorbidity, between COPD and diabetes and sleep apnea and so forth. And so one patient has many different things, and so they have to have a relationship with a nurse. It seems to me that the role of nurses is only going to become more important in the system. And I wonder whether the medical associations are going to promote or not promote giving nurses more authority than they have now. I'm thinking of nurse practitioners. And why couldn't they write prescriptions? Why couldn't they take on more authority? Because we don't have enough primary care physicians to go around. And I think the role of nurses is going to be increasingly important, and it's not about technology. It's exactly what you said. It's about building a relationship and trust with these individuals who have very high comorbidity between different disease states.
But it does get back to the issue of aligned economic incentives. And today, our providers, be they hospitals or individual physicians, don't have an economic incentive to provide that care coordination. Our health plans do, but as patients, we generally speaking don't want that from our health plans. We want it from our providers. And one of the things I'm actually working on right now, helping a friend to incubate, this is independent of HLM, is a business where through your doctor effectively on a private pay basis, you can buy access to a health advocate who acts as your own personal coordinator, your own personal navigator in a friendly, personable, proactive manner. And hopefully we'll get to the point over the course of the next 5-10 years where you get that through the system. But in a lot of places, it doesn't exist today.
Do you think that'll be reimbursed? Is there a way to get the advocate reimbursed, or is that going to have to
Well,
be
at this point,
privately paid?
at this point, the way we're envisioning it is all private pay.
Yeah, that sounds like a good idea. Though.
But I can tell you that, at least in our experience, nurses have been the great, they make the real connection in terms of using technology and the interaction. And I think that it's due to the communication that it's needed. The quality of the communication. Nurses are used to communicating in a different way with patients, which is sometimes difficult for physicians or for, and it has been very useful. We really go in a, I would say we're more confident that there's going to be a good interaction when the nurse is involved in the follow-up of what the information is. Even if it's in the cloud, the nurse brings it down to her computer and they can have the interaction. So I agree with you, it's the human component. Yeah. It's even, I would say, exponentially important when you have technology involved.
We have time for one more brief question.
This is not a question, but it's a statement. My name is Peter Buck. I'm a gastroenterologist from Connecticut, digestive health specialist. One of the misconceptions, and again, to bridge from clinicians to those in industry, is what is the incentive for physicians to coordinate? That is for us to do the right thing. And again, there's several of us physicians in the audience. If I have a patient who is 94 years old with congestive heart failure, a couple of strokes and other things, who needs a colonoscopy, I'm not going to just go and do a colonoscopy willy-nilly. I'm going to check with the cardiologist, I'm going to check with the primary care doctor, and I'm going to check with the neurologist, not because I'm getting reimbursed for it, because I'm doing the right thing. So I wanted to set that straight for all of you and for several of the commentators this morning.
So how do you feel, I mean, because a very high cost of our healthcare system is end of life. How do you deal with that with patients and family and your own value system?
The answer to that is you have to spend the time,
yeah.
Whether you're reimbursed or not, yeah. Because it's the right thing to do for the patient. And again, I speak for many of my colleagues across the board. We take the hits. Yeah. We don't get reimbursed for all of that time. And that's one of the issues that we've had with regard to the cognitive behaviors of medicine. We're not reimbursed for that anymore. Yeah. I'm paid much more for my colonoscopies than my cognitive skills. Yeah. And I take offense at that. Yeah.
Dr. Buck, I would agree. I've got a GI condition, which is why I'm on Remicade for ulcerative colitis, and I get great and very well coordinated care from my gastroenterologist. But I would argue that you and he don't have enough time in the day to coordinate care to the degree it does to make me less expensive, and so I think, and this is not at all a knock on clinicians, be it nurses or physicians. I think there's a need for something more, and the reimbursement system has to change in order to accommodate that. It's good, but it could get better, right? That's sort of the point of that, yeah.
Thank you, Doctor. I want to wrap up with two speed round questions, if you will. So what we've talked about what you are investing in and focusing on the consumer side. What have you seen that might fit the category of conventional wisdom? That is, getting lots of attention, it's hyped, you're not investing in it. What are you not investing in or pursuing, and with a quick description of why?
We've stayed away from transparency solutions to date. For the following reasons. The data appears to be very hard to get from the payers. It appears to be very challenging to organize. And some of the payers believe that they're going to offer, or claim that they are offering these solutions on their own. And again, to my general bias, we think that transparency is part of a solution for the generally well, but it's not. We're really focused from an investment standpoint on the top 5%, on the sickest of the sick. And for that portion of the population who spends their out-of-pocket deductible, transparency really doesn't matter as much.
Okay.
So we've elected not to invest there.
From my standpoint, we're not a fund, we're a family office. So we tend to focus on businesses that we can get pretty deeply involved. We're not part of the management, but we try to do a lot of other things to help the CEO and their team. So they have to be businesses that we have some comfortableness of the domain and our network of sort of relationships in the ecosystem. So I don't have anything to do with pharma. Not that it's not a good place, I just don't know anything about it. I wouldn't make good judgments in it, so I steer clear of pharma. That's why I was very interested in the discussion this morning about how challenging it is. Convinced me even more that I shouldn't be in pharma.
Yeah. Roberto?
Well, it's a difficult question for me because it's not an investment. It's more where you're going to put your resources in order for something that can change. And I would say that it's in the perspective that today a public system as Mexico has, where you have 100% coverage, people have the assurance that they have a health provider at some point. You want to make sure that it is of high quality and it's totally transparent and you can really monitor and you can measure. I think we're not really on that business of the puzzle, but on that side of the puzzle, but I think it is very important to make sure that now as a citizen you have the right for a service. You want to make sure at some point that you, and maybe the technology can help for that, and that's something that we would like to analyze.
Flipping it around, what's the investment or resource commitment you're making that you expect to have the biggest impact in 3 to 5 years, and how big?
No question, is to have a way that we can really change the paradigm of how today the health services are provided, to really focus on prevention. As last night it was, Dr. Oz mentioned the issue of the 5 measurements. We're doing that in Mexico City subway.
How many people do you think you're going to reach?
We need to reach, I would like one day to reach, at least in 1 week, the 5 million people that go through the Mexico City health system, subway, to have their 5 measurements, and then to have a follow-up. And I think follow-up can be done through technology. So I would say that's going to be the right investment, to go into prevention, more than to just maximize the issue around curative care.
And we're basically out of time, so I'm just going to ask for the very quick answer. Favorite investments? Right now, I know it's like picking your favorite children, but
anything to do with serving the self-insured employer market, because it seems like the biggest game change out there from the system, from the things I'm interested in.
Mm-hmm.
I would love to find an investment in a company that could really quantify both outcomes and quality of life around cancer treatments.
Okay, great. All right, thank you very much. Thank you.